start. So again, with carpal tunnel syndrome, you also want to look for pathologies in the shoulder and also the elbow and even the neck. So that would be a more of a global treatment. You do that first, you do your needling, but we're going to talk about working more locally. So no surprises here. We're going to start by doing Molofa and Twifa on the flexors and extensors, and sort of warming that up. Your main area of treatment is going to be the flexors. You're going to find a lot of osseous points, particularly along the upper flexors. So do a bit of rolling to loosen it up. And then you're going to really look for osseous points and do anfa. So we're going to grab and do a cross fiber technique, looking for where that's tender and just maintain a bit of pressure there. You can also do other things. You can do Ijir Chanfa, one finger meditation to deactivate the points. And remember that you want to have a feeling of distension and soreness. You getting that?
Mm-hmm.
Okay, great. So when that's cleaned up and you feel more mobility there, we're going to move more distally. And we're going to go into the actual area of where the carpal tunnel is. So from here, you're going to put one hand on Sanjiao 4, one hand on PC7. You're going to depress and do a little bit of traction so you get a little bit of joint play. And you're just going to do gentle rotations. Don't go too far here. You shouldn't be going to the full range of motion, but just get a little range of motion. And then we're going to finish with a bit of traction. Lastly, you're going to mobilize the radial and ulnar. So we're just pressing and moving the bones a little bit, trying to create space in the carpal tunnel. And the last piece is you're going to do a myofascial technique where you're going to put traction along the forearm, and you're going to have your partner do flexion and extension as you apply traction. So just do flexion and extension. Okay. Yeah. And the goal here is we're trying to stretch, get some space in the fascia. And that's that. All right.